Here at HealthSnap, we partner with healthcare organizations to help patients manage their chronic conditions remotely. Our clinical team provides ongoing support to keep patients engaged and on track while giving providers valuable insights between office visits. Our approach to our home monitoring programs are three-pronged. First, we identify eligible patients using condition data and insurance criteria along with provider recommendations. Second, we send white labeled patient letters on behalf of your organization that are mailed directly to patients' homes, introducing the program and its benefits, such as nurse access, followed by a brief voice recording letting them know that someone will be in touch with more details soon. HealthSnap's enrollment team then calls patients to explain the benefits of the program, confirm shipping address, and obtain and document verbal consent for participation. For those patients enrolling in RPM, we provide cellular-enabled devices that are pre-configured and ready to use out of the box. Patients won't need a smartphone or internet connection to participate. Once the devices are delivered, HealthSnap Care Navigators will assist with the setup and education and then begin monitoring patient data and alerts. Our care navigators then maintain regular contact, building rapport, setting goals, and addressing patient needs. These activities are billed monthly, and at the end of each month, HealthSnap will generate a comprehensive billing eligibility report, which will include all eligible patients, corresponding codes, units, and relevant dates of service to ensure accurate, compliant billing and streamlined workflows for your team. I'll now pass it over to HealthSnap's Chief Scientific Officer, Dr. Wesley Smith, to touch on some of the clinical benefits these programs can bring to your patients.
Hello, I'm Dr. Wesley Smith. I'm a co-founder and the Chief Scientific Officer at HealthSnap, and I'm very excited to go over our clinical outcomes across our 25 million data points, as well as across over 100,000 patients that have been on the program. I think it's important to point out that when we founded the company, we actually came out of a medical school academic initiative and pre-med program initiative where we were doing research on home devices and integrative methods of care to manage patients remotely with chronic conditions. We felt that obviously monitoring body weight in patients, we'd be able to identify decompensating heart failure patients. In diabetics, we'd be able to monitor glucose for dysglycemic events. For hypertension, we'd obviously be able to identify hypertensive crisis. All these obviously made sense from a proactive care standpoint. What we didn't expect was a medicinal improvement in patient outcomes without any change in their care. So we were seeing patients with being monitored for blood sugar with diabetes. We saw an average of a 25 to 30 point reduction in their fasting blood glucose, which is similar to a glucose lowering medication, again, without changing their medication or any other area of their care. When we looked at patients being monitored for hypertension, simply monitoring the patients and sharing with them the evidence-based lifestyle recommendations and care plans, we saw about a 14-point drop in systolic pressure, which is similar to a blood pressure lowering medication. So with these clinical outcomes being so impressive, we decided to take what we were doing out of the academic silo and bring it out as a private company. And this is before remote patient monitoring codes existed. So fast forward to today, we see that remote patient monitoring is getting a lot of interest from the clinical and scientific community and research community. In fact, these are presentations that we just gave at the 2025 American Heart Association conference. They usually accept about 15 to 20% of research presentations. We submitted 6, and all 6 were accepted. We also see that this is a sign that people are starting to catch on that remote monitoring of patients with chronic conditions is making a significant difference, not only in clinical outcomes, but reducing utilization and lowering costs. And the clinical ROI is so obvious that as we share outcomes with CMS directly and with Ways and Means Committee, we see that among all the cuts that are being made in Medicare and in Medicaid, we actually see an expansion of the RPM codes in 2026 for RPM. And we also see an increase in reimbursement because the clinical ROI is so apparent. Now, in addition to that, one of the things that we're seeing is that over time, blood pressure is continuing to improve and blood sugar is continuing to improve for patients that have been on the program for years. And this is an example here of 30 months. You can continue to see on the y-axis a decrease in systolic blood pressure. On the z-axis, you can see the decrease in diastolic pressure among hypertensive patients over time. And for blood pressure monitoring, patients that trigger alerts in the first month, we can see that by month 12, these patients have about a 97% reduction in the number of hypertensive related alerts that they trigger because patients are being managed better by their provider. We also see that from blood glucose lowering standpoint, we see a lot of the same magnitude of benefit and highly statistically significant, clinically meaningful improvements. But when we look at diabetic patients across zip codes and according to socioeconomic status, we see that as expected, there's a linear relationship with the socioeconomic status of the patient. The patients in the lower socioeconomic zip codes have their blood glucose more poorly managed than those in the higher. In fact, there's a very strong linear relationship, a 0.98 R value, so a very strong correlation based on socioeconomic status. But then after the RPM program, that correlation goes away essentially, and all patients, regardless of zip code, regardless of socioeconomic status, see a similar benefit from remote patient monitoring. When we ask patients what do they attribute these benefits to, because again, they were surprising. Even as a co-founder, I can say from a proactive style of care, we expected improvements in patients reducing ER visits and readmissions and hospitalizations. So we expected that, but what we didn't expect is to see these really dramatic improvements in blood sugar, blood pressure, body weight, just from the monitoring itself. So when we ask patients what they attribute these benefits to, because this is observational research, this is not prospective randomized controlled trials, just real world evidence from a very, very large pool of data. The patients say when surveyed that 95% of them feel more connected to their physician. Sometimes physicians wonder that if they do the RPM program, is HealthSnap going to sweep in like a third party and interfere with the relationship with their patients? But no, we actually see that the relationship and the bond between the patients and their provider becomes stronger. They feel a greater connection. They feel a sense of security. And with that, they also feel some accountability. So they're more likely to stay medication compliant and adhere to their care plan. We know that the relationship with the clinical staff from HealthSnap makes a big difference as well. That continuity of care and that bond is important, as well as the health literacy that's built in that helps give patients what they feel is some control over their condition. So we see an increase in self-efficacy among almost all patients in the program. Nearly 80% of patients say that they changed their lifestyle as part of the program. And among those, nearly 90% attribute the benefit of the program to those lifestyle changes. So last but not least, and as I mentioned, there's been a lot of interest from CMS on the clinical ROI. And the clinical ROI basically is about 18 to 1. So every dollar spent on RPM, there's about $18 of savings. And it makes sense because if you think about it, you can monitor a patient for approximately 50 years for the cost of one ambulance ride and a few days in the hospital. So when we look at this high risk, high acuity Medicare cohort, this was retrospective. I think that's very important to point out. We decided to look back with one of our health system partners as to whether we had utilization and cost data on patients that were already in the program. And we found 589 patients where we had at least a year's worth of cost-related data, healthcare cost data, and utilization data prior to starting the RPM program. And then we had a year after they started the RPM program. So we were wondering, of course, without knowing the answer, that's the whole point of doing research, is did these patients save on costs and did they have less utilization? And it turns out that in these 589 patients here, there was about $6.7 million of gross savings in the year on RPM just for this cohort. After the RPM costs, there was $6.34 million of savings, an 18 to 1 return on investment, driven mainly by fewer ED visits, fewer hospitalizations, fewer readmissions. The overall median cost of care in this high acuity group went down in 1 year by over $14,000.